Obviously, this is a sad situation where we hear of someone passing away in an emergency room or in any care facility within the province of New Brunswick. And I can say from this side of the House, it always breaks our heart when that happens, and our condolences and sympathy goes out to the family and friends of the individual that passed away last night or Tuesday. And you know, and also to the healthcare workers that did their best to try and save the individual. And Mr. Speaker, those are the ones that wear it the most. When the member across the way, you know, points at the government and says it's our fault. Mr. Speaker, we know that there's frontline workers standing up day in and day out every day trying to help the people here in the province of New Brunswick. And we are trying to get help for them with some of the recruitment efforts that we're putting forward and some of the additional hires. And I know the Premier, myself, some of the other ministers meet on a regular basis with the trustees and with the CEOs, again, trying to find out where and how we can help, how we can work together in making sure that the resources, and when I say resources, that covers whether it's HR workers, whether it's facilities, and Mr. Speaker, that's the type of work that's being done, and there has been steps made. Unfortunately, situations like this overshadow some of the good news announcements that are moving forward. I'll have a statement later on today about some of the excellent initiatives that's going to increase the access to surgery. Again, we're moving forward with initiatives. I can talk about initiatives in the emergency rooms such as the patient monitors. I can talk about initiatives in the emergency room such as patient care monitors and the continuum of moving that patient along as quickly as possible as the resources are available. And we could talk about additional social workers in the ER as well to, again, triage with some of the people that are in there feeling stressed and facing some of the stresses of the day. And Mr. Speaker, we can talk about some of the recruitment efforts that have resulted in additional doctors, in additional RNs, in additional personal health care workers. Mr. Speaker, contrary to what the members across the way are trying to roll out today, we're doing the work, we're getting it done. Bill 3 is going to provide help because there's people coming off retirement in order to help in some of these clinics, Mr. Speaker. We are, well, along with the RHAs, recruiting internationally. And Mr. Speaker, there's been great results in some of the initiatives Vitality and Horizon have taken in recruiting internationally trained nurses. Mr. Speaker, we've, with the help of PEDAL, moved forward with the navigators that will help internationally trained medical individuals to navigate the system, to get their credentials recognized, get a position within the RHAs, and again, provide the help that's needed to those that are already there. Mr. Speaker, we know that the extra seats will take a number of years before they get on the floor, but I'll tell you this, right now, we're recruiting additional individuals to help the people that are there now.